Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today, I want to discuss with you a case scenario about a girl with absent periods. Okay? So, let us start this case scenario. A 19-year-old virgin presents with an absence of periods for 6 months. So, there is no menstrual flow for 6 months. This condition has occurred once before in the past, and the menstruation returned spontaneously. So this absence of menstruation happened before and returned spontaneously. So this is the second time to happen for her. Her period started at the age of 12 years. So this is a menarche. The first menstruation in her life started at the age of 12 years. Is it normal age? Yes, it is normal age. And the cycles were initially regular. She has no medical history of note and denies any medication. So she has no history of medical disease and she received no medication. She is the oldest of 4 siblings and her parents separated when she was 14 years. She has no contact with her father and lives with her mother. She is currently in her second year at university. She runs most days and reports a healthy diet avoiding carbohydrate foods. Her body mass index is 16 kilogram per square meter. Of course, 16 kilogram per square meter in body mass index indicating she is underweight. Okay? Because we know the normal from 18 to 18.5 should be above 18 normal, right? So she is 16 kilogram per square meter, so she is underweight. Abdominal examination reveals no scar or masses. Her serum FSH is 0.5 international unit per liter. Of course, this is lower level than normal. Serum LH is 0.7 international unit per liter. This also lower than normal. And serum estradiol is 15 picogram per milli, and this is of course lower than normal. So FSH, LH, and estradiol decreased. Her body mass index below normal, so she is underweight. She is thin. She is exposed to many stresses related to social life, separation of the father and the mother, and no contact with her father. Also stresses of university, being the students, studying, and so on. Also, looks like that she has an anorexia. She is not eating carbohydrate, and her weight is lower than normal. And also, she do exercise. She run all days of the week. So, she do exercise. All of these are key for the answer for this case. What is happening for this girl? Okay? So, what is the possible diagnosis? And what is the investigation needed for such a case? And what is the treatment? Okay, let us try to think. What is the possible diagnosis? This is a girl, 19-year-old, has secondary amenorrhea, 6 months. She is underweight, exposed to multiple stresses related to social life, related to university studying in her faculty, and also she has an anorexia, and she do regular exercise. She runs, as I said before, nearly all the days, most days. She runs most days, and avoid carbohydrate diet, as I said. Her hormonal profile revealed lower FSH and LH, follicular stimulating hormone and the luteinizing hormone, produced from anterior pituitary gland, which stimulate the follicle in the ovary for growth. So if this dropped, so there is no stimulation for the follicular growth in the ovary. And so estradiol is expected to be lowered, as mentioned here also, it is 15 picogram per ml. So this is a case of secondary amenorrhea due to hypogonadotrophic hypogonadism, anorexia nervosa, anorexia nervosa. So this is the diagnosis, secondary amenorrhea due to anorexia nervosa with evidence of hypogonadotrophic hypogonadism. I have an evidence of low FSH and the low estradiol level. As I said before, her body mass index also dropped to 16 kilogram per square meter, and usually no menstrual flow if the body mass index dropped to this point. So to regain the menstrual flow, body mass index should be 18 or more. Okay? And anorexia nervosa is considered hypothalamo-pituitary cause. So this condition may be due to various pituitary or hypothalamic causes, but in this case clearly relate to anorexia nervosa and possibly excessive exercise. This is as regard the diagnosis. What about the investigation? I need to confirm the previous results, so I am going to repeat the FSH, LH, and the estradiol, then ask for serum prolactin and TSH. We know the effect of prolactin and the TSH on menstruation. And it is expected, by the way, in a stressful condition, as in our case today, the prolactin may be higher than due to stress. TSH, thyroid stimulating hormone, of course, I can evaluate the function of the thyroid by thyroid stimulating hormone, and it has an effect on menstrual flow, of course. Then I'm going to ask for CBC, liver, and renal function. Why? Because in some severe conditions, these factors may be affected. Liver function, renal function may be affected in cases with anorexia nervosa, and the patient may be in need for admission to the hospital. So I should do CBC, liver, and renal function to evaluate the case very well. Then what is very important also is a bone scan. You should do DEXA to evaluate the bone if there is osteopenia or osteoporosis, because hypoestrogenism is likely to induce early onset osteoporosis and fractures. So this is very important. Also, what is very important also in workup is to do psychological assessment to guide the appropriate treatment. So I can say in our workup in such case or investigations, lab test, bone scan or DEXA to diagnose if there is osteopenia or osteoporosis, psychological assessment for the case to guide appropriately. Okay? So what about the treatment in such case? First, encourage the girl to eat a more normal diet and to avoid exercising. So you should advise her, stop exercising. Please try to eat a normal diet. Okay, encourage her. You may refer her to specialist in eating disorder to give help for her. Also, give her combined oral contraceptive pill to prevent osteoporosis and bring on periods. Okay, so we are going to give cyclic estrogen and progesterone as in combined oral pills to prevent osteoporosis and bring on periods. In some cases, you may need to do hospital admission for such case if the investigation suggests renal or hepatic impairment, because we know that anorexia nervosa may reach up to life-threatening condition, affecting the liver and the renal function. So, in such cases, I should admit the patient to the hospital to give her the proper care and management. So, this is our case today, secondary amenorrhea due to anorexia nervosa, hypogonadotrophic hypogonadism. I hope it was clear enough. See you later on with another lecture or case scenario discussion. This is my box published on Amazon. You can find them via this link. I'll put it in a comment. Textbook of Obstetrics, textbook of Gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and gynecologic oncology book. My best wishes for all of you, everybody.